Welcome to Part 2 of Medication Administration for ESY and Summer School Staff. Part 1 of Medication Administration provided you an opportunity to become familiar with your school health office and the various tools and resources within it that will help support your ability to safely and accurately administer medication to students. We discussed how the health office is organized and how medication is safely and appropriately stored. We also reviewed the differences between prescription medication, over-the-counter medication, and controlled medication. In addition, we reviewed various types of emergency medications that students may need during the school day, as well as the location and proper use of stock epinephrine. In Part 2, our focus will be on proper hand hygiene, the 6 rights of medication administration, accurate and appropriate documentation, and maintaining student privacy and confidentiality. Proper hand washing is the single most important procedure to prevent the spread of infection. Hand washing should include vigorous rubbing together of all surfaces of soap-lathered hands for at least 15 seconds, followed by rinsing with warm water. Hand sanitizer kills germs from the surface of the skin rather than removing them as hand washing does. Hands should be washed before and after providing care for a student, after touching any contaminated surface or equipment, after coming in contact with bodily fluid, before eating, and after using the restroom. You should wear gloves if there is a risk of coming in contact with blood or other bodily fluids, if you have any open sores or cuts on your hand, or if touching medication is unavoidable. The preferred practice for giving medication is to pour the prescribed dose into the cap or use a medication cup to transfer medication from cap to student's hand. We should never count medication on the counter. We should always use the counting tray. The following safeguards must be followed every time medication is administered to a student. Only give medication to one student at a time. Never prepare medication ahead of time, and always follow the 6 rights of medication administration. The 6 rights of medication administration include the right student, the right medication, the right time, the right dose, the right route, and the right documentation. The 6 rights are prominently posted in every LCPS health office. Following the 6 rights every time you give a student medication ensures the medication is being given safely, accurately, and appropriately. Per Virginia Code and LCPS School Board Policy, a medication authorization form signed by both parent and prescriber is required in order for school personnel to administer medication to a student. The first dose of a new medication should always be given at home. Prior to giving a medication at school, the school nurse, principal, or principal's designee should review the medication authorization, parental consent, and medication label or packaging. You want to ask yourself, do I have the correct student? Is this the correct medication? Is the dose correct? Am I giving it the right way? Is the time correct? Is the order signed? And is the order current? Prescription information on the bottle label must match the healthcare provider information on the authorization for medication administration form. You should always check this form prior to giving the medication to a student every time. The first right of medication administration is the right student. You must ensure you are giving the medication to the right person. Ask the students to state their name prior to giving them medication. Look at the pharmacy label. Does it have the correct student name printed on it? Check the medication authorization form. Is the correct student name written at the top of this form? Show the student the medication bottle or package and ask them, is this your name? Remember, there are 3 required checkpoints that you should always verify before giving a student medication. The correct student, that the label matches the order, and the order matches the label. Next, you want to ask yourself, do I have the right medication? Am I giving the right amount? Please note the equivalent liquid measurements on this slide. 1 cc is equal to 1 milliliter. 5 cc's is equal to 5 milliliters, which is also the same as 1 teaspoon. 15 cc's is the equivalent to 15 milliliters, which is equal to 1 tablespoon. and 30 cc's is equal to 30 milliliters, which is the equivalent of 1 fluid ounce. If there is ever any doubt about the medication or the dose that is to be given, stop, call your resource nurse, and ask for help or guidance. Medication must be given at the right time. The right time is the prescribed time. However, medication may be given within 30 minutes before or 30 minutes after the prescribed time. Medication may not be given outside this window. If a student does not come for their medication at the prescribed time or within the allowed window, follow up with the student. If a student misses a dose, notify their parent or guardian. This is a medication error, and then contact the resource nurse for your school.
Route refers to the manner in which you are giving the medication. Most daily medications are given orally. Inhalers and nebulizers are inhaled. Insulin is injected in the subcutaneous tissue of either the arm or abdomen. Epinephrine and glucagon are always injected in the thigh muscle. And Diastat, a medication commonly prescribed to treat seizures, is given rectally. You will have the opportunity to practice and demonstrate the proper administration of each of these medications in the hands-on portion of this training.
This slide illustrates some of the most common medications found in your school health office and the routes by which they are given. Pills and liquids are given orally. Insulin is injected subcutaneously into the fatty tissue of the arm or abdomen. Bronchodilators used to treat asthma are inhaled. Epinephrine, used to treat anaphylaxis, and glucagon, used to treat severe low blood sugars, are intramuscular injections, and Diastat, used to treat seizures, is given rectally. This chart lists some common medication routes that may be prescribed by a medical provider and the abbreviations you may see written on the prescription or medication order form. If you are unsure how a particular medication should be given, stop, call your resource nurse, and obtain clarification and guidance prior to giving the medication. The final right of medication administration is the right documentation. Full-time health office staff enter all their documentation in the student's electronic health record in Phoenix. Substitutes and medication-trained health office backup staff complete their documentation using the straw-colored health office visit record. The daily medication and procedure worksheet is a very helpful tool that at a quick glance lets you know which students have scheduled medications and procedures and the times at which they are due. This worksheet is also helpful in identifying students who may have forgotten to come to the health office for the medication or procedure. If this happens, be sure to follow up with the student who does not arrive for their scheduled time, as the right time is an essential component of safely and accurately administering medication. Giving a student their medication outside of the allotted time period is considered a medication error. On the left is a copy of the LCPS Health Office Visit Record that is used by Health Office substitutes and Health Office backup staff. This is required documentation for every Health Office visit and will be completed every time a student is given medication, has a medical procedure performed, or receives care for an illness or injury. This form becomes a part of the student's permanent school health file. On the right is the daily medication procedure worksheet. This is an organizational tool only. It helps you prepare for your day and at a quick glance tells you when and who will be coming to the health office for scheduled medications such as daily oral meds or pre-PE inhalers, or for procedures such as blood sugar checks, nebulizers, G-tubes, or catheterizations. You will use this tool to help organize your day, but your actions and care provided will be documented on the straw-colored visit record. All written documentation must be completed in ink and must be signed and dated. Documentation of medication administration must include the following: the student's full name, ID, and grade, the name of the medication, the amount of medication given, the time the medication was given, and the route by which the medication was given. If a student comes to the health office because of illness or injury, document what the student said, what you saw, the care or treatment you provided, and whether the student went back to class or home. Your documentation should always be objective, clear, comprehensive, and factual. All students have the right to know why they are taking medication. If a student has a question or concern regarding their medication, call the parent prior to giving it. A student does have the right to refuse their medication. If a student refuses, never force it. Rather, notify the parent and document the circumstances of the situation and your communication to the parent. Student privacy and confidentiality is protected by 2 federal laws. The Family Education Rights and Privacy Act, also known as FERPA, ensures the privacy of educational and health records. HIPAA prevents the disclosure of protected health information without written authorization. School personnel should consider all information, written, oral, or electronic, that is related to a student's physical, mental, or developmental health status as confidential. Student health information is shared on a need-to-know basis only. Only health information that will benefit the student's health, safety, or education should be shared with school personnel. School administrators should know the health concerns of the students within their schools, and teachers should know the health concerns of students within their classes so they can appropriately respond to a potential health emergency. Information that is shared from students with the health office staff should always remain confidential with the exception of threats of self-harm or harm to others. All student records, care plans, and physician orders should be kept in files or binders and not left out in the open. Sign-in logs listing students' names and the reasons for their visits should not be used. Students should be cared for one at a time in a quiet, private area. Students waiting to be seen should remain seated in a private waiting area. Phone calls to parents and medical providers should be done in a quiet, private location away from all other students, staff members, parents, or school volunteers. A medication error occurs when medication is not given exactly as prescribed by the provider. A medication error is defined as giving too much medication, giving too little medication, giving the wrong medication, giving expired medication, giving medication to the wrong person, giving medication at the wrong time, giving medication via the wrong route, and forgetting or missing a dose. If a medication error occurs, you must immediately notify your school resource nurse or supervisor of student health services, your school administrator, the parent or guardian of the student, and call poison control if indicated. Medication errors can be avoided if you slow down, always follow the 6 rights, and provide care for one student at a time. The majority of medication errors are 100% avoidable. Most medication errors can be traced back to forgetting to follow the 6 rights. So how can you avoid a medication error? Slow down, follow the 6 rights, match the order to the medication, and only provide medication to one student at a time. The number to poison control is prominently posted in all school health offices. Poison control should be called anytime the wrong medication is given to a student, anytime too much medication is given to a student, if a student has ingested an unknown or foreign substance, if you observe unusual side effects after administering a medication, or if you suspect a drug interaction. Now let's take a moment to recap what we've learned. Student safety is the #1 goal of student health services. This training was designed to prepare you to safely and accurately administer and store medication during the school day. This slide highlights key points and expectations which will not only support student safety, but also prepare you to successfully take on the responsibility of appropriately administering medications to students while under your supervision and care. Always know the medication you are giving. Always, always, always follow the 6 rights. Always have a written order from the provider or signed medication authorization form from the parent. Always give the medication exactly as it is prescribed. Always give the medication to one student at a time. Keep medications locked at all times, with the exception of the home ed cart, which stores our emergency meds. This remains unlocked during school hours. Always check expiration dates, and always document your medication administration as soon as possible. Now that we know what to do while handling and administering student medications, let's focus on what not to do. Do not allow students to bring you medication unless they have permission to self-carry. Do not accept medication without an authorization for medication administration form, and it must be signed by either the physician or the parent or guardian, or both, depending on the medication. Do not accept medication that is not in its original pharmacy or over-the-counter packaging. Do not accept expired medication. Do not cut or crush pills. Do not prepare medication ahead of time. And do not leave medication cabinets unlocked. Do not take shortcuts, and always, always, always remember the 6 rights every time.